I was drawn to emergency medicine from my first year as working as a doctor. I loved the dynamic environment. To a certain extent, perhaps I loved the chaos, but more organising the chaos that was the emergency department. I love the variety of patients, from newborn babies to patients who are over 100 years old. I liked that we saw people, we fixed them up, or if we couldn't fix them up, then we helped them, and then we sent them off in the right direction. In emergency medicine, you never know what your day is going to involve. That's part of the attraction, part of the excitement, and I think that's what continues to draw me in. So from that first year, I set my career towards developing skills to be a good emergency doctor. And like a lot of us, that involves doing different specialties, some intensive care, paediatrics, anaesthetics, general medicine, infectious diseases, so that I could prepare myself for working in an emergency department. Since gaining my specialist qualifications, I've worked in a number of different departments, and I've always enjoyed the camaraderie of the teams that are there. I've always loved the work. But there's no doubt that emergency medicine can be difficult at times. It is chaotic, it is shift work, it can be a 24/7 job. We're with people in what can be the worst moment of their lives. We're there sometimes at the beginning of life, and sadly, way too often at the end of life as well. So I'm still passionate about what we do in emergency medicine. Through my journey, I've really wanted to contribute to emergency medicine beyond just the patient in front of me. So that's one thing that drew me to EMF, to the Emergency Medicine Foundation, and contributing as a board director and later as a board chair. And for that same reason, I've been a part of the Australasian College of Emergency Medicine, known as ASEM, for more than a decade now in a variety of roles, including Queensland Faculty Chair. I've been Vice President of the Patient Safety and Quality Committee. I've contributed to Advancing Women in Emergency and other different projects along the way. And I think, looking forward, I will continue to contribute to not just emergency medicine and the patient in front of me, but my department and my hospital, to really improve what we do, to better my skills, but also to enhance, support those around me so that we can provide the best health system possible. For junior doctors or medical students, as they're thinking about what specialty might suit them, I really would recommend emergency medicine. If you're someone who likes to think fast, you like to be on your feet, you like to be surrounded by other people, you enjoy a dynamic environment, then emergency medicine may well be for you. We are quite a large college, and we do have a relatively open front door. So we do like to attract new trainees, support them through the registrar training years, and of course there is some hard work to be done to pass exams, to do the shift work, to learn all that there is to know about our very broad patient base that present with a variety of problems. But as specialists, we're a cohesive group. We enjoy each other's company, we support each other. The vast majority of us love our work. Emergency medicine can be quite varied, so you might work in an emergency department, but you also might work in a helicopter doing pre-hospital work. You might work in a coordination centre for retrieval. You could work in a virtual setting providing emergency care to someone who is remote to you. And of course, some emergency physicians team their qualifications with other specialties as well, such as intensive care or palliative care or sports medicine. So I think a lot of doors open for those interested in emergency medicine. It's quite easy to be mobile, to work in a different state, or perhaps just take a short time off and work in a remote setting, work overseas, or work in some different areas. And another good thing about emergency medicine is you work hard while your shift is on, but when you go home, you really do get to clock off. And I find a lot of my colleagues will have really exciting passions that they pursue outside work. And that's important so that we can enjoy work when we're there, but look forward to other things when we're not there. So for medical students, junior doctors, and those who are uncertain which specialty to pursue, please do consider emergency medicine.